Hi, my name is Erin Foerstel, and this is my Head to Do assessment for a health assessment class for Maryville University. This is my friend Rachel, and she's volunteered to be my assistant for today's exam. Rachel has been told to empty her bladder. We did a set of vital signs and also a height and weight. I have washed my hands, and now I'm ready to begin the exam. So first of all, we are going to start with the head, making sure it's normal cephalic, no bulging or lesions anywhere, and then it's a normal shape, and also going to be checking the hairline. Let's go ahead and palpate the head, and the texture of the hair is nice and thick as well. Now I'm going to move on to the facial bones. So I'm just going to palpate the facial bones, make sure there's no bulging or any lesions or anything abnormal. And Rachel, if you can open for me and close, and what I'm feeling for is the TMJ. Now I'm also going to palpate the sinuses, so do the frontal sinuses and the maxillary sinuses. And then Rachel, if you could do a couple things for me. If you could smile and clench your teeth, puff out your cheeks, stick your tongue out, and furrow your brow. Very good. And then also what I'm going to do is I'm going to test the sensation. So I'm going to take a Q-tip and just go along the perimeter of the face to make sure she can feel the Q-tip. You feel that? Mm-hmm. Here? Mm-hmm. Here? Mm-hmm. Here? Mm-hmm. Here? Yep. And here. Mm-hmm. All right, very good. Now, we'll be moving on to the eyes. So first noting the shape of the eyes. So they're round, they're oval shaped. Checking out the sclera. There is no yellowing of the sclera. And also going to be checking out the conjunctiva and the lacrimal apparatus, which all looks very good. The eyebrows are symmetrical, and the eyelashes, they curve outward as well. So now I'm just going to be checking the pupils and if they are equal and reactive to light. Directly and consensual. And then again, correct. Alright, and then if you'll just follow the light with your eyes only. And she has very good movement of the pupils. They are uniform, and there is no gaze, outward movement. Very good. Now, if you'll just cover the right eye with your right hand, and then look straight ahead with your left eye, and then again, cover the other. And is that equal to you as well?
Yes.
Great, very good. Now I'll be moving on to the ears. So first of all, just checking the ears. They are in line symmetrically. And then I'm also going to palpate. So palpating the article. Everything is soft. There's no bulging or any lesions. And also the pinna as well. I'm going to check the other side also. And now Rachel, we're going to be doing the whisper test. So if you will cover your right ear, and I'm going to whisper something into the left ear, and if you can just tell me what I said.
Apple.
And then we'll do the other side.
Orange.
Very good. And I'm also going to be doing the Weber test and the Rainy test, and what this is going to be doing is measuring the air conduction. So I'm going to strike the tuning fork, and I'm going to put it on the top of her head, and this is the Weber test. Can you hear the vibration?
Yes.
Then I'll be doing the Rene test, so that'll be placing it on the mastoid bone, and then I'll be doing it in front of the ear, and this is going to measure bone and air conduction.
No more.
Very good. Then next I'll be checking out the nose. So the nose is midline. Be palpating it for any bulging to feel if the septum is deviated, and it appears to be midline as well. So now I'll just be taking my pen light and looking up the nares. Each nair, there is no bulging. The septum appears to be midline. There are no lesions or any growths visible, and there is cilia present in both nair. Alright, we'll be moving on to the mouth now. So Rachel, if you can open your mouth for me. And first of all, I'm just going to be checking the mouth So there are no broken or missing teeth anywhere, no visible cavities, overall good dentition. You can stick your tongue out for me and say ah.
Ah.
And the uvula does move freely in the back of the mouth, and the tonsils are intact as well. The gums are pink, and there does not appear to be any lesions or any areas of concern. Now, next I'm going to check the trachea, make sure that it is midline, and also palpate the thyroid gland as well. And the trachea is midline. And Rachel, if you'll go ahead and swallow for me. Very good. And then also while I'm in the area, I'm going to be checking the carotids. I'm going to auscultate the carotids and the thyroid gland now. And swallow. Very good. I'm going to briefly check the strength of the neck. So I'm going to put my hand to the side of Rachel's head and have her try and resist both ways. So first of all, Rachel, if you can move your head from side to side and up and down and shrug your shoulders for me. All right, now try and resist. Good. And this side. Very good. And this side. And downward. Good. And backward. Very good. She does have great strength. And I'm going to be checking out the lymphatic system, palpating the lymph nodes in the face, the cervical and clavicle area. So preauricular, postauricular, the occipital, tonsillar, submandibular, submental. Very good. The superficial cervical chain, posterior cervical chain, deep cervical, and clavicular. And that's all very good. So now I'm going to be moving on to the lungs and the chest. So first I want to inspect the chest. The chest appears to be normal in shape and size. There doesn't appear to be any areas of concern. So I'm going to go ahead and auscultate the lungs. Take some deep breaths for me. And what I'm listening for is making sure there's no wheezing, stridor, bronchi, or rales. And if you put your arms out to the side, I'm going to check the lateral lungs as well. And before we do the posterior side, I'm going to check for tactile firmitas and do percussion. Say 99 for me.
99. 99. 99.
Okay. Alright, then you'll turn around so I can do the back side. And again, looking at the back, the skin appears to be normal, no bulging or any lesions of any kind, no rashes, or there are areas of concern. Just go ahead and take some deep breaths. And once again, listening for any wheezing, any rales, any stridor, any crackling of the lungs. Again, I'll be doing light percussion and then checking for tactile firmitas. if you'll say 99.
99.
And again.
99.
And again.
99.
And again.
99.
Good. And then while I'm back here, I'm also going to check for the diaphragmatic excursion. So Rachel, take a nice deep breath for me and let it out. Okay. And again. Alright, and the marking between the two sounds is right in this area, so again about 3 to 5 centimeters. Alright, Rachel, if you'll turn around for me. And now I'm going to be listening to the heart. So I'll be also taking the heart sounds, so I'll be doing the aorta, the pulmonic valve, Erb's point, the tricuspid valve, and mitral valve. Listening for S1 and S2. And the rate appears to be regular, no crackling or murmur. No clicks or murmurs. Okay, Rachel, if you'll lie down, we'll do your abdominal assessment. First, before starting the abdominal assessment, we're first going to assess the abdomen, making sure that there's no areas of concern. There's no bruising, there's no bulging or any herniations of any kind. I'm going to start by listening to the bowel sounds. You're listening in all 4 quadrants, and if no bowel sounds are heard in any of the 4 quadrants, I'll be listening for 2 minutes. I'm going to do a little light palpation of the abdomen. Make sure there's no tenderness. And then some deep palpation to feel for the liver. And then for the spleen. And then also the kidneys. I'm also going to do some percussion to feel for the borders of the liver and the spleen as well. Alright, looks good. I'm also going to listen for the arteries of the abdomen, including the iliac, aorta, and femoral. Okay, very good. Let me sit. Now I'm going to check the extremities. So Rachel, if you'll stick your arms out, and just noting the appearance of the skin. There doesn't appear to be any ecchymosis, any lesions, any rashes of any kind. So start by palpating the brachial pulse. And the radial pulse. And then if you'll squeeze my hands, just checking the strength of her grips. Very good. And then raise your arms up for me and try to bite me. Very good. And then I'm going to check the reflexes of the brachial and radial arteries. I should see a slight twitching of her hand. Very good. Very good. And again. All right. So now I'm going to be moving down to her legs. First of all, looking for any swelling, any edema of any kind, and she does not appear to have any. I am going to start by checking the pulses of the legs. So I'm going to do the popliteal, the posterior tibial, And the penile pulse. Very good. And I'm also going to check the reflex of the Achilles tendon. Okay. And then if you can press down on my hand, very good. And then pull back, and I'm just testing her strength. Very good. And then if you can just let your leg dependent, I'm also going to check the patellar reflex. Okay. Relax. Very good. Okay. And the other side. So once again, the popliteal, posterior tibia, and the pedal pulse, and the Achilles tendon. And then if you'll press down on my hand, once again, just measuring strength, and pull back. All right, very good. And then if you'll stand up for me and just face the wall, I'll have you bend forward and just check the curvature of the spine. So the spinal column is midline. There does not appear to be any signs of scoliosis or kyphosis. And then we'll just check her gait and balance. So Rachel, if you'll just take a step or two forward, and then turn and go the other way. Very good. You have a seat. And that concludes my health assessment. Thank you.